A sub-regional workshop on standard indicators for drug information networks in the Caribbean is currently taking place at the conference room of the Ministry of Health, Wellness and the Environment. This event is organized by the Inter-American Observatory on Drugs (OID) of the Inter-American Drug Abuse Control Commission (CICAD) in conjunction with the government of St. Vincent and the Grenadines through the Ministry of Health, Wellness and the Environment. Representatives from Barbados, Jamaica, Grenada, and Guyana, along with local stakeholders, are participating. The Inter-American Drug Abuse Control Commission (CICAD) is the organization of American states agency that serves as the Western Hemisphere's policy forum on all aspects of the drug problem. The goal of CICAD is to foster multilateral cooperation on drug issues in the Americas, to execute action programs to strengthen the capacity of CICAD member states to prevent and treat illicit and illicit drug abuse, to combat production of illicit drugs, and to deny the traffickers their legal profits. CICAD promotes drug-related research, information exchange, specialized training, and technical assistance. CICAD also develops and recommends minimum standard for drug-relation legislation, treatment, and the measurement of both drug consumption and the costs of drugs to society. The Inter-American Observatory on Drugs (OID) assists member states to improve their capacity to collect and analyze drug statistics. The OID support member states in the implementation of drug surveys and other studies, in addition to promoting the development of establishment of national drug observatories and the use of standardized data and methodologies. The focus of the meeting is for participants to examine the indicators that were developed by CICAD to guide countries in the collection of drug-related information in a standard way. The countries will be expected to pilot these indicators in their own setting for a period of time, after which the process and indicators will be reviewed, amended as needed, and expanded to other countries in the region. Countries will benefit from this exercise by having better organized and more available drug-related information that leads to better policies and responses to the problem posed by drugs. Determine the prevalence of psychoactive substance use at least once in lifetime over the last 12 months and over the past 30 days. It would also determine the prevalence of psychoactive substance use on the basis of socio-demographic characteristics, gender, age, occupation, schooling, socioeconomic level, and place of residence. It will also detect patterns of use of the various substances. It would describe aspects related to the use of substances, exposure to supply and use, risk perception, exposure to talks of courses on preventions, among other interests, and it will generate the information needed to inform drug policy and related programs. The workshop will introduce participants to the Drug Information Network (DIN) and its usefulness. It will present examples of how networks in the Caribbean operate. It will provide a detailed review of the standard DIN indicators. It will discuss issues such as stakeholder maps and engagement of stakeholders. It will prepare work plans for each participating country for the implementation of standard indicators, and it will allow for discussion and interaction among participants.
We have also been able to put in place once again a GEG expert who's sitting in the room here with us, and I'm also very pleased to note that our own GEG expert has also been given added responsibilities at the regional international level. We have also been successful in reviving a technical body, a technical group, which could provide some support to the National Drug Council. But I note to you as well that we do still have some way to go. I'm making all that statement to say that in St. Vincent and the Grenadines, we are really renewing our effort to actually come fully on board where CICAD is concerned, and to be able to ensure that we are in a position to respond to this international phenomenon in the war on drugs, specifically to respond to or to have in place strategies that can address the supply and demand reduction of drugs. One of the areas that I know we are lagging behind on is our revising and updating of and finalizing of a anti-drug plan or strategies. I know there is one which is rather aged now, which is very old, and we have set about and have made some effort in reviewing the anti-drug plan, but we still do have some way to go. So, again, we are on target, and we are at the threshold of actually having in place the National Drug Information Network System and also a National Drug Observatory. I made a point that there are some of our sister countries which are already doing well, so our effort and our hope would be to be able to move ahead in ensuring that we have a National Drug Information Network System and a National Drug Observatory in place.
Yeah, you would have seen me scribbling some notes there on my notepad as the PS spoke. I was scribbling some points that I wanted to make, and as I scribbled, I was scratching everything because the PS touched on everything I wanted to say. I thought the Permanent Secretary was spot on in, first of all, clearly identifying where St. Vincent is in its effort to revive its National Drug Council. I'm pleased to hear, Permanent Secretary, that you have a technical body in place. Your GEG expert, I know, is working with the MEM team, the Multilateral Evaluation Mechanism team, as we speak. And I'm also glad to hear that you're on the verge of setting up a National Drug Observatory. You mentioned, PS, that some of the things that you're going to need would be technical support, not only from CICAD, but from other sister countries who've been through this process already. Well, Permanent Secretary, today is the day. CICAD is here. We have Grenada, Jamaica, Guyana, and Barbados, 4 countries that are at various stages of developing their drug information networks. So feel free to draw on the expertise and the experience of these folks in the room over the next couple of days, and I will throw in my 2 cents worth as well. Just to pick up on what the Permanent Secretary was saying, the Inter-American Observatory on Drugs, our role is essentially to support countries to develop systems that help them to collect the information and the statistics that they need to make good drug policy. The PS was right when he said that the days of developing drug policy based on the first thought that enters your brain or your own personal experiences are over. In fact, any policy that you're developing, any national policy, needs to be based on evidence. And he used a word that I am very familiar with, that I'm very supportive of, the scientific approach. That is making sure that you understand what your situation is and that the responses that you put in place respond to your peculiar situation, rather than just shooting in the dark. That's the role of the Observatory on Drugs at CICAD, and that's the role of any national observatory. The role of any national observatory should be to collect the information that the country needs on drugs, to analyze this information, and to report and disseminate it to all of the stakeholders, whether locally or internationally. That's the role of the observatory. And what we're here to do is to support the observatories in the region and in the hemisphere, for that matter. And in particular, one of the reasons why we're here in St. Vincent having this, and this is a technical event, this is why it's so small. As soon as we're done here, we're going to roll our sleeves up and get into some work. But the reason that we're here in St. Vincent is because we know where you are in terms of your re-establishment of your council. And we thought that it would be a benefit to St. Vincent to have this event here at this particular point in time. So we're pleased to be here. Thank you very much, Permanent Secretary, for your very, very warm welcome. I'm glad that, I know we have persons here representing the Ministry of Health, Ministry of National Security, Financial Intelligence Unit. I think Marion House is supposed to be here, prisons, etc. So we're looking forward to interacting with you throughout the day. So I want to make a formal presentation to the Permanent Secretary of this document. I know you don't have a copy of your own, so I just want to present this on behalf of CICAD to you.
Hi, so we're Mr. Pernell Clark, and we're at a drug workshop pretty much. He'll tell me about his role here and what we can expect after. This is the final day of the workshop. What can we expect after today?
Okay, so over the past couple of days, we've had 5 countries, including St. Vincent, in this room working on drug information networks and how we could implement standardized indicators for the collection of drug data. We started the first day by looking at these indicators in detail, actually going through what type of information drug information networks should be collecting, supply reduction data, demand reduction data, etc. And then today we went through an exercise of stakeholder mapping where the drug information networks in the countries represented here, Jamaica, Grenada, Guyana, Barbados, and of course St. Vincent, actually outlined in great detail in a pictorial view what the stakeholders would be for their drug information networks. The workshop so far has been very, very interactive. There has been great participation by not only the overseas representatives but the local representatives as well, and I'm pretty pleased with how things have turned out so far. In terms of where we go from here at the end of this process, what we hope to achieve is, first, that we get the countries participating to actually implement those standard indicators. We developed those standard indicators because most countries did not have a guide to show them how they should be collecting information in a uniform way.
Right.
So having this guide and these standard indicators will allow us to not only collect information in the same way from year to year and from period to period, but across countries as well. So we're hoping that the overseas participant countries are able to implement those indicators in their drug information networks, and their drug information networks are at various stages of development. Here in St. Vincent and the Grenadines, and this is one of the reasons why we're having the event here, you are in the process, I've been told, of now re-establishing your drug council, re-establishing your drug secretariat here under the Ministry of Health. And one of the things that you're going to need to do is to put systems in place to collect drug statistics, understand the drug situation, collect the information or generate the information that you need for policy. A drug information network will help you to do that. And the indicators that we've been looking at over the past couple of days will help you to organize that information in such a way that you can collect it consistently in a standard way, that you can analyze it, and that you can report and disseminate it to all of your stakeholders so that your policies and your programs that you implement in response to the drug problem are based on the realities of the situation here in St. Vincent and not on what people feel or what they believe, nothing anecdotal, based on science. So that's one of the things that we hope to achieve. More concretely, we would love to see a drug information network in St. Vincent actually set up. Okay. Using these indicators, of course, and moving forward, we are hoping at the end of the day to have some timelines with some concrete activities, along with persons responsible who would implement the various steps needed for the drug information network here in St. Vincent and the Grenadines to become a reality.
All right. So we're here with one of the participants in the program or the workshop, and she's from Jamaica. You'll tell us your name and who exactly from Jamaica you're representing, what organization.
Okay, I'm Uke Atkinson from the National Council on Drug Abuse in Jamaica.
Okay, so
Yes.
in terms of what you've learned here over the past 2 days, how beneficial you think it would, or applicable you think it would be to Jamaica in terms of where we are and where we need to be?
Okay, well, this workshop has been extremely beneficial to all of us, particularly for us in Jamaica, where we have recently relaunched our drug information network. And so, participating in these workshops assists us in terms of the necessary tools that we need for the drug information network. So the identification of the various stakeholders, which include persons from law enforcement, from the health sector, education, etc. That has been really a good thing for us to hone in on who really needs to be in our network, as well as the kind of information that we would collect from each of the stakeholders. So it has been really beneficial for us.
To be able to work along with other members of the region and to be at the table pushing ideas and working together? How do you think that has been?
So we have had a number of capacity building exercises with colleagues across the region, thanks to the Inter-American Drug Abuse Control Commission, CICAD, particularly the Inter-American Observatory on Drugs, which is running this workshop. And throughout these experiences, what we have found is that you get a lot of, there's professional exchange, there's learning about what's happening in other jurisdictions, learning about, the techniques and methodologies that other member states use that can be beneficial. So there's a lot of sharing of experiences and, that builds all of us up. Yeah.
I learned one thing sitting in the thing, and I'm pulling it like just because it's Jamaica, and I'm stressing it out a little bit.
Right.
But this Sprite thing, there is this Sprite thing that was discussed. Can you just tell us a little bit so that we can share that with persons who may be watching?
Sure. So this is something that is relatively new to our shores. It is not a new substance. It's called lean. It's a mixture of codeine strength syrup, cough medicine, with typically clear soda, as well as sweets. And this is something that we're seeing not only in Jamaica, it's in Trinidad, it's in Barbados, it's in other countries as well, among mainly the secondary school population. And so we have taken, it gives a high. It's not a traditional substance. And what we have heard, we've not done any studies, so we were able to tell you about prevalence and that sort of thing, but we have done qualitative work with students, and what they say is, it's not as bad as the traditional drugs. They don't feel like, it's not smoking ganja, it's not drinking alcohol, it's just cough syrup. But the danger with that is when you mix something that was intended for medicinal purposes, right, and you're not tracking the amount. With codeine and cough syrup, you get a particular dosage, and what they're doing is just pouring it and drinking it over time, which can have some serious health effects.
So we're here with the local participant in the 2 days workshop. Can you tell me your name? Obviously you represent custom, but tell me your name and how the last 2 days in terms of this workshop has been for you.
All right, my name is Eddie De Freitas. I'm from the Customs Enforcement Supervisor Preventive. The last 2 days I would say was very informative. I think this program is going to work for St. Vincent and the Grenadines. It can assist policymakers since we need to move now towards a systematic way of making decisions as it pertains to drug and interdiction and so forth. So yes, I think we're on the good road.
Has there been anything new that you've learned? I have certainly learned about new drugs that, especially young persons have been using. Is there anything that you can say that you've learned new in this workshop over the last 2 days?
Well, it certainly was a refresher for me. You get to learn basically certain trend in the society today. We realize how certain on-the-shelf drug can be used to basically influence youth.
Right.
And so we can basically, with this knowledge now, one can basically seek to redress these sort of problems going forward for the youth, because quite naturally the youths are our future.
And working with other Caribbean islands in terms of putting heads together to talk about the issues and how you address them, how do you feel?
Yeah, well, you hit it right on the nail. Networking is always good. Today, you have criminal network.
Right.
You have transnational crimes. You have across-border crimes. So, yeah, we need to match the bad guys.